Hi, everybody. Thanks for being here on day two, diving in with a great opening session on the We Think Twice campaign. And so now we're excited for this one with Dr. Mitakidis. He will be sharing on the impact of the STI epidemic on adolescent driving, as Julie said. We have just a screen here after this that'll have a brief disclaimer. And then I would like to introduce Dr. Mitakidis. He is the Chief Scientific Officer for the Medical Institute, and he has held national and international healthcare leadership roles in Africa, Asia, the US, and serving in the HIV and AIDS community and public health. He's really passionate about strengthening communities. He's a wealth of knowledge, and I'm excited for you to get to hear from him. So I'll let him take it away. We will have time for question and answers at the end. So just keep that in mind that we'll field those at the end. All right, to you, Dr. Mitakidis. Thank you.
Awesome. Thank you, Melissa. Thank you for that introduction. And thank you for the opportunity to share on this amazing topic, not only because of its importance, but also because of its lasting impact in our society as well as our families. So essentially what we're going to do now is we're just going to take 45 minutes just to look at basic overviews of the current STD and STI trends, the implications. We're going to look a little bit about trends specific to the age group that we are targeting in terms of this talk. And then we're going to hopefully have some time for Q&A. So as you can hear, my accent is from South Africa, born and studied medicine there with postgraduate interest in tropical diseases, tropical medicine, and primary health care. So that's kind of where my passion lies, and having done a lot of public health in different countries, this has kind of always been one of the top 5 discussion points in many public health programs worldwide. So our outline for the next 40 minutes or so is we're going to look at some of the basic issues, the principles behind the STDs, STIs. We're going to look at trends specifically amongst the youth and impact, looking at physical and emotional well-being impact on our teens, as well as opportunities and challenges that lie ahead. So let's start off by talking a little bit about the STD, STI principles. And just to start off by saying that this is such an amazingly big topic. It's difficult to put so much into it. There's so many details, so many interesting facts about this. So I've just highlighted some of the top issues that are many teenagers or adolescents are asking questions about in terms of STDs and STIs, and some of those that have specific reference to how that impacts our societies and our patients. So we know the organisms of STDs, STIs, bacteria, viruses, parasites, different types and categories of STDs, STIs. And you'll notice that I'm referring to STDs and STIs interchangeably. There are so many points of view in terms of is it an STD or an STI, and that I think is a totally different topic we can discuss. But for the purposes of a simplistic approach, I will mention STD and STIs interchangeably. Right off the bat, it's important to understand transmission. Transmission is acutely important in not only understanding how the STDs spread, but also how they impact and how they are not only spread, but also cause damage in our various bodily systems. So classically, we see skin-to-skin spread, as well as via bodily fluids. Essentially, through sexual activity, that's the highest transmission route is vaginal, oral, and anal sex. Skin-to-skin transmission, in terms of concept there, that's important to understand, and we all are aware of that, is not all condom coverage area usually covers a known or an unknown STD lesion. For example, partners that have used condoms before, even consistently and correctly, may still get transmission of an STI and STD because some of the sites of the lesions may not necessarily have been covered by the condom coverage area. And there are other multiple issues in terms of condom effectiveness, condom consistency, and correct usage, and all sorts of issues, which is a totally different topic. But the one huge area to understand is the site of the STD lesion may or may not be covered by the condom during a sexual activity, and that happens to be a contributing factor relating to transmission. We also know that there are other routes of transmission. Mother to child is huge. Breastfeeding, it does pose a threat. Needle sharing and blood products always remain issues, particularly sharing of needles. We see in some pockets some epidemics in certain areas, in certain geographic areas where drug use and abuse is used in certain communities. Other risk factors that are important to highlight in terms of transmission risks. These are extremely important because each one of these points, and there are more, highlights the risk that gets accumulated in terms of transmission. So, for example, the type of sexual activity determines a risk as well. Anal sex, more highly risky than oral sex, for argument's sake, and that has been documented and shared in the major sites like the CDC website and CDC papers in terms of that. Needle sharing, critically important. Risk of multiple partners. We know that that's not only important with asymptomatic STDs, but also important in terms of the unknown. So, for example, if there are cases where 2 or 3 partners have changed partners within that same year, the multiplication factor is immense in terms of multiple factors and multiple partners getting transmitted without even knowing. So that can happen very rapidly as well. So the other underlying risk that is important to mention is a concomitant STD. For example, with genital herpes, HSV2, that particular infection is associated with a 2 to 3-fold increase risk of HIV infection. And we can understand why that is important. The one STI, the genital herpes, breaks down layers, creates inflammation, brings more blood and inflammatory cells in the area. The barriers of protection are essentially broken and creates an easier entrance of an HIV virus to enter that field, that defective skin or mucosal membrane. So here we have having one STD associated with a 2 to 3 time-fold increase in getting another STD. That's quite important. The immune status, obviously we know with immunity dropping and the general well-being of a patient dropping, it's more and more difficult to treat and more difficult for the body's defense mechanisms to be able to create some barrier there and some protection. We also know with end-stage AIDS or untreated HIV, the viral load remains extremely high. So that means the volume, the amount of virus particles in a given volume of bodily fluid is obviously higher than, let's say, a treated HIV patient on antiretroviral medication. So that's also very important. Other factors are important, including the organism and how it responds to medication, how virulent it is, and vaccination status. Something that most public health programs are really putting tons of effort in the immunization status of HPV, the hepatitis B and A virus as well. In terms of treatment, we know generally speaking, most of the bacterial infections are mostly treatable. There are pockets of drug resistance that we see. The viruses are typically manageable. There's treatment available to manage the infection, although most of the viral STDs are long-term and lifelong. Parasites and yeast infections are mostly treatable. And typically we know that patients say, but I got treatment. Yes, it was treated, but many of the complications remain irreversible. Many of the complications may not come back to be reversed. Many of the functions, the damage that can be an underlying damage of the reproductive system may not return back to normal, even after the treatment has been successful. So knowing the complications versus just the treatment, I think it's also important to patients and their families, as well as to future impact. Primary prevention, again, we're not going to go into too much detail, but essentially primary prevention for the amount of time, money, and effort, and in terms of return of benefits is massively outweighs most of the other types of prevention, and that we'll discuss later on with sexual risk avoidance education as well. Again, I'm mentioning asymptomatic STI. Here we have the asymptomatic patient that doesn't know they have an infection, cannot see a rash, any bodily fluids, or cannot see a lump, cannot see a lesion, and does not fully understand, or is actually essentially clueless as to an underlying STI. And that can obviously create a rapid spread environment because the partner doesn't even know as well, no treatment is sought after, and the underlying damage can continue in the reproductive system. Even early underlying malignancy or cancer can be on its way to being developed. Briefly on trends, and again, as you've seen, we've touched very gently and very lightly on these topics. There's so many to discuss. Just highlighting the points here. Medical Institute does have an online training opportunity for those that do want to dive in and do kind of self-learning, a self-paced online course that is available to dive into some of these topics. But from a trend perspective, we see that the epidemic has had unprecedented increases. On any given day, and this, even though it says 2018, these stats were released in January this year, so obviously it accumulates all the projections based on a 2018. So next year we're going to get the 2019, even though it's published in 2022. So 2018, these are the latest stats we have, and we have 1 in 5 people had an STI, totaling nearly 68 million infections. So those are current infections, but of those, 26 million were new infections in 2018. And as you can see there, almost half were among youth aged 15 to 24. Now that's something just to take sit back, take a breath, listen to that comment and understand the implications in our nation here. 26 million new infections, unprecedented increases, half of them among youth aged 15 to 24. We're seeing the highest number of some of the STIs ever reported in our history. So this is becoming a huge issue, not only an issue just to talk about, but something that is impacting so many of those patients that need the help and care and guidance and support in decision-making. But why is this unique to adolescents? Why do we see such a massive increase of STDs, STIs among our adolescents? Why are they in such a unique risk category? And I think that's very important to try and to understand. We know, for example, that the prefrontal cortex, this is executive function, executive decision-making, is still developing. We were initially under the impression that by 20, the brain is formed, right? Well, now the years, they're saying mid-20s and possibly later. So the executive functioning of decision-making in terms of risk, in terms of discussing certain decisions and implications, that executive functioning is still developing in our adolescents. Additionally, adolescents are more likely to engage in high-risk sexual behavior. What does that mean? At that age, we know higher risk behavior in multiple aspects of their lives. That can be a good thing. That can be a great thing in terms of advancement, in terms of learning, in terms of innovation, in terms of making a difference. But the high risk capacity also has its potential issues as well. So in terms of high risk sexual behavior, we see more likely in terms of multiple partners or having sexual activity without condom use. Another interesting thing is that, and we know this as well, adolescents are less likely than adults to utilize sexual health services. Because they're going to use them less, we know they're probably going to get screened fewer times, probably going to be asked fewer questions or fewer opportunities for healthcare providers to spend time with the adolescents and to ask them particular questions regarding sexual risks. Additionally, from an anatomical and physiological perspective, adolescent females are very susceptible to some STDs as well, particularly HPV. And there's a number of physiological and anatomical reasons why this happens. Essentially, some of the cervical mucus around the cervix is decreased. The cervix also is slightly open and more exposed into the vaginal entry as well. So you've got these susceptibility issues from an anatomical and physiological perspective. So in essence, adolescents have a higher chance of STD exposure, lower chance of screening, lower chance of getting a diagnosis, and a lower chance of treatment. So all those concepts combined, and these are some of the risks why this is happening. That's what we're seeing, an explosion of those are some of the reasons why we're seeing STDs on the rise. And those are kind of things that we could think of and brainstorm as to how do we tackle those things? How do we make a difference in this epidemic? Looking at some of the rates, and this is the slides in terms of the charts here. I just wanted to highlight some of the impacts in terms of some of the STDs and how they impact men versus women. And these slides are available from the STD website of CDC. Very interesting. Chlamydia, as you see, the last 18 years is on the rise. You can see from 2000 to 2018, it's on the rise. Who is it affecting? Mostly women. Let's look at the next one. In terms of breakdown of chlamydia by age group, so this is an interesting chart. You will see the age group column in the middle, the different age groups from 10 to 14 for argument's sake, and 15 to 19, all the way down to the total. And the left, you will see the male, and the right, you'll see the female rate. Who is affected? Can you see the chart that's showing the ages of 15 to kind of 29, massively affecting the female population in terms of chlamydia, that vulnerable age group. Let's look at gonorrhea. Gonorrhea from the 40s down all the way to 2018, you can see that curve that's starting to go up since 2007, starting to increase recently as well. And if we stratify that further, we see that gonorrhea primarily or affects men more than women, right? You can see that in 2018. Look at the total women and men, and you can see the rates as well. Syphilis happens to be something that's rising again. We saw in the 40s, it was something totally out of control. Programs came in, treatment came in, screening came in, but we are seeing a rise of the different types of syphilis, the total amounts in 2018. If you look at primary and secondary syphilis, rates reported by age, group, and sex, you will see the male rate is much higher than the female rate. You will see the age groups from the 20 to 24 right through to even close to the 44, that whole group of the male age group is being affected. Look at the totals in terms of the quantum of rates between male and female. 3 versus 18.7. You can see how the male rates are massively increased. HIV, another concerning STD, STI. From 2010 to 2018, well, we are seeing some kind of plateauing, but it's still concerning. This is 18 years later, from 2000 and now 2010 to 2018, we don't see much of a dent in terms of HIV incidence. If we stratify and get an estimated HIV incidence among persons, specific in terms of age groups, look what's happening at the age band of 25 to 34. What do you notice? You notice an increase from 2010, it starts to climb, and 2016 kind of starts to plateau. All of a sudden, we have that vulnerable age group. And again, the 13 to 24, we are seeing a dent there as well, but you can see the changes. So the trends among US high school students, this was surveyed in 2019 under the National Youth Risk Behavior Survey, and this is available online, a fascinating survey. You will see some highlights there that are important to mention. In 2019, the students that were surveyed, 38% have had sexual intercourse, 9% had multiple partners, 7%, this is an alarming statistic, 7% have been physically forced to have sexual intercourse when they did not want to. That's a 7% that should not have happened. And that typically comes with its own risks of STD transmission. Look at that interesting 27% had had sexual intercourse during the previous month. Of those, close to half did not use a condom. 12% did not use any method of preventing pregnancy, and 21% had drunk alcohol or used drugs before the last sexual intercourse. Now we know drugs and alcohol have an impact on the central nervous system, have an impact in terms of decision-making, have an impact in terms of risk-taking, all right? Now you'd add drugs, alcohol, specifically with a prefrontal cortex that's not been fully formed. You can understand some of the risks there for transmissions, some of the risks behind the issues we're seeing now in terms of the numbers of the epidemic. And finally, the less than 10% of all students were tested for HIV. So access in terms of testing, in terms of STD testing and HIV testing, fairly limited. Let's talk about impacts. And again, we are whizzing past all these facts, but I do appreciate and thank you for paying attention on how this is impacting our adolescents and those around us. From a present impact, we know that there are an array of pathological and physical manifestations. Things like infestations of some of the STIs, some of the skin lesions that we see. There's different types of infections from depending on where the infection is at that moment. It could be in the urogenital system. It could be anywhere. essentially causing inflammation, causing abscesses, causing destruction of tissue, and pelvic inflammatory disease, a PID, which out of intersect is not reportable. And that's something that we don't have a full understanding yet of the impact of PID, but we know it's massive in terms of infertility and in terms of chronic disease. Emotional and mental health impact, the impact on pregnancy and babies transmission. We are seeing some syphilis increases. In fact, it's the worst ever reported in terms of congenital syphilis now with babies in the US. And obviously the impact to the sexual partner that is not aware of an asymptomatic infection. In terms of long-term impact and potential consequences, PID, which we mentioned, pelvic inflammatory disease, can cause destruction of the tubes, fallopian tubes, can cause infertility. But even if there is conception, even if there is fertilization that does take place, it could result in an ectopic or an implantation of a pregnancy, not in the typical womb or uterus, and cause an ectopic pregnancy, which can be lethal to the mom. There are various cancers that are formed in terms of long-term. We know the AIDS-related cancers. We know there are hepatitis B-related cancers, hepatitis C-related cancers, destruction of the liver. We know that there are cancers around the anus or genital areas. We know there's chronic disease and chronic illness relating to adhesions and chronic pain. There's work incapacitation, time taken for treatment, time taken to go and get tested, the impact of work and the impact of scholastic or school achievement, and relationships, impacting relationships as well. Recently reported the immense economic drain, and you can all have a look at the CDC website. Fascinating is to see the latest stats on $16 billion. New STDs total nearly $16 billion in direct medical costs from a national perspective. Another worrying trend now is STD drug resistance. And this is the resistance that we're seeing from some of the bacteria. They're starting to become more and more difficult to treat. And we are seeing some of those pockets internationally as well. So opportunities, right? We have immense opportunities to make a difference. We have opportunities to always bring hope and to make a change and to bring stability with many of these issues. But in terms of challenges, firstly, I'd like to highlight some of the issues we're facing right now. Many of you, we are sensing the immense burden of the pandemic, the COVID-19 pandemic that has had on our situation and isolated many people, healthcare systems, many of them really overrun and totally overwhelmed by COVID infections. We know the challenges of sexual violence, sexual trafficking, and stealthing are important. And stealthing has become something that is a very worrying new trend we are seeing of essentially when a condom is removed without the consent of a partner. So for those who are not aware, stealthing is a dangerous trend that we're seeing where some don't even know it's happened. But those that are reporting it could be even in 1 in every 10 sexual activities that a condom is removed without the consent of that partner. Essentially sexual abuse and assault that takes place and high risk in terms of spreading and transmitting an STD. Prevention also to focus on hard-hit populations. We know there are populations that don't have access to healthcare, that have certain limitations in terms of of education and in terms of support, in terms of funding. So those are just some of the few challenges around. But there are opportunities. We know the primary prevention in SRAE, specifically with the education linked to sexual risk avoidance, has got lasting effects and very positive outcomes for our adolescents. We know that CDC, against the data around avoiding STDs is there. And this is a common statement you will see from most healthcare agencies, stating that the surest way to avoid STDs is to abstain from vaginal, anal, and oral sex, or to be in a long-term mutually monogamous relationship with a partner who has been tested and known to be uninfected. We know that there are benefits of delayed sexual activity, and we're going to go through a few of those shortly. We know that strengthening the sexual risk avoidance education, the curricula, helps in identifying areas that we need to strengthen. And we know the opportunity in behavioral counseling, as deemed important by US Preventative Services Task Force, stating spending time with our patients, spending time with our families in discussing what behavioral issues are around high-risk sexual activity, about the questions about abstinence, the questions about the benefits of delayed sexual activity, and having those discussions and interventions are important. In terms of the OPRE report, which was published last year, very powerful in highlighting the benefits of delayed sexual activity, reduction in pregnancy, reduction in STI transmission, reduction in chances of living with an unmarried partner, improved relationship and satisfaction among couples, increased chances of high school graduation among girls. These are founded on databases that say delaying sexual activity has reported a reduction in symptoms of depression in the short term. And the opportunity here is, how do we take some of these benefits and share them and educate and encourage those around us to what the possibilities are in terms of the benefits of delayed sexual activity. So in terms of the education, the curricula, sexual risk avoidance education, it's great to consider some of these basic topics, some of these issues that we've highlighted, including the talk about risk and prevalence and incidence. In other words, incidence, new cases, prevalence, how many total cases we have, and why we're seeing such a massive increase. And this problem is not going away. The concept of instilling the asymptomatic definition in there to understand how immensely dangerous it could be in terms of asymptomatic STDs spreading through multiple partners. Talking about contraceptive effectiveness and ineffectiveness. Specifically there, we know that in condom use, there's so many things that could go wrong. Even with consistent and correct use, there is never 100% protection promised by anyone. In fact, so many things do go wrong. It's almost never, there's almost never the possibility of getting correctness and consistency there. So those are high risks there to be spoken about and to be taught about. Risk reduction versus risk avoidance, and we've spoken about that as well, the pathway to optimal sexual health and impact, long-term, short-term. We've mentioned the emotional, we mentioned the relational, as well as the importance of testing and treatment of self and partners. We can talk about things, but we also have to also talk about the testing. And CDC does a wonderful job of putting guidelines as to how often to test, when do I test, what categories get tested, what happens with the testing. Is it just a test and treat? What about decision-making around the testing and the treatment, and also the discussions around decisions and behavioral modifications. There's an urgency to address this epidemic. Interesting comment from Dr. Merman. He's the director of CDC's National Center for HIV/AIDS, viral hepatitis, STD, and TB prevention. What are we seeing? What does he say? The burden of STIs, and I'm going to read this because every time I read this, I really understand that here's someone, leadership level in CDC, recently quoting this a few weeks ago. The burden of STIs is staggering. At a time when STIs are in an all-time high, they have fallen out of the national conversation. You can just hear his heart. But not only that, but we as parents, as colleagues, we care about our youth. We care about our adolescents. We care about those around us. We care about long-term consequences. And we want our youth, we want our families to thrive. We want them to be empowered. We want them to know what's happening. We want them to be empowered in terms of decision. We want them to understand there is an opportunity for zero risk. And we want them to understand there's support and care and there's compassion, and we're together. We're going to get this, and we're going to work together. There's an opportunity to address this urgent issue. So thank you for taking time to hear me ramble about STDs and STIs, and I wanted to at least take an opportunity to hear any questions. But as you can see, this conversation will continue. We have an immense opportunity, an immense responsibility for those who are in this area, for those who are dealing with relationships, to dealing with this incredible topic of sexual risk avoidance as a primary prevention strategy to make a massive impact and hopefully diminish and decrease this epidemic and this impact in our society. Thank you.
Wonderful. Thank you so much, Dr. Minikitis. There's so much information there, and I really appreciate you highlighting the importance of this topic, especially in the work that's being done in the SRAE field. So it looks like we have a couple of questions. One asks, it looks like a couple of them are similar, but one says, do you foresee a possible downturn in STD cases as a result of social distancing and quarantine related to the COVID pandemic?
That's a great question. And I think we can speculate. But whatever we thought we were going to gain out of COVID, I'm seeing the exact opposite happening, right? So for example, unrelated to STDs, what are we seeing? We're seeing an increase in drug overdoses. We're seeing an increase in abuse at home. We're seeing an increase in sexual violence. We're seeing an increase in crime in some areas. So those combinations tell me that although we thought social distancing was working, I think there might even be a worsening of our data, a worsening of real cases even. And let me say why I believe that. And this is just a prediction, so I may be totally wrong. I hope I'm wrong. But if you see what they announced, what CDC was talking about in late December, specific to COVID, for example, they said that many STD programs either had to close their STD clinics or reduce capacity. Fascinating. The few STD programs that we do have, which are limited in terms of in our communities, many of them shut down. Many of them reduced capacity. Some of them were citing, and this is coming directly from CDC, someone was saying, we don't even have enough PPE, personal protective equipment, for us to go to work to. We don't have enough staff. A lot of the work was diverted to COVID clinical work. So already we see decreasing programs. So what's going to happen? Fewer patients seen, right? We also had there was concern that because of now decreasing programs and reduced capacity, the asymptomatic individuals probably getting fewer screening, right? So if we're going to screen much less, we're going to pick up much less of those asymptomatic cases. What does that mean? It's going to spread. It means, I don't know, I have an infection, so it doesn't look like it. I haven't had a chance to screen. I'm going to continue as is. I don't have an opportunity to share and talk to a trained professional in terms of risk avoidance. So that impact of shutting down clinics, reducing capacity, I think will have its own impact on it as well. Interesting enough, during this time, Melissa, fascinating question this is, if you see on one of the multiple websites, some of the key antibiotics that were used for STDs became very difficult to find. There was an acute shortage of azithromycin, which is used for STIs. So again, the drugs are being decreased, supply chain disruption, diagnostic equipment, they say, went down. Nearly half of the labs doing testing in the US reported some at least concerning shortage of diagnostic equipment. So the labs wouldn't work 100%. The STD programs were down. Things like mental health, we all know mental health did not do well during COVID-19. It was tough. It was a tough year, and it still is tough. Many are still seeking help. Suicide, mental health, depression, anxiety. So all those combined, I think the melting pot, I think we're going to see a rise. It may not be reported because we have fewer to report, but possibly the year after we may see a jump. Again, that's a prediction. I hope I'm wrong. It was a tough year.
Well, I hope you're wrong in that too. I'm going to join you in hoping that we don't see that, because it sounds like it's a pretty dire situation as is. If you can click through a couple slides there. If anyone else has questions, go ahead and post those in the chat, and I'll read those out for Dr. Mitikidis to answer. I think that question is probably speaking to the heart of the biggest concern at the moment. And I think that asker was correct in kind of hoping that social distancing and keeping kids separated would be reducing, but I think you bring up some really good points there, and that there's so many factors to consider and how it might impact future rates. Another question that came in was, you had mentioned the impact of PID, or pelvic inflammatory disease. So I wanted to see if you would explain a little more about the impacts that you meant there.
Absolutely. I think PID is very often, one of those things that, first of all, is not typically reported. There's no specific reporting requirement for PID. Various states have their own reporting, and there are some studies trying to understand, reporting, is it connected? Are some connected with gonorrhea or chlamydia, or you know what I mean? So first of all, we don't have a full picture of that because of the reporting requirements. We do have specific reporting requirements related to gonorrhea and chlamydia, but when it comes to just PID as the syndrome, as the complexity of the damage done in the female reproductive system, we don't have that. So that's kind of worrying us. And we know this is a clinical syndrome. It's a combination of a spectrum of infections and infectious and inflammatory diseases that all combine and characterized by damage done to the vagina, the cervix, upper female genital tract, including we call it endometritis, salpingitis, basically inflammation and infection of the female reproductive system. But then it starts spreading outside the boundaries of the female reproductive system. So that's when we get into the pelvis, and that way you can get even things like inflammation and even abscesses under the liver, and sometimes a septic shock can take a patient's life. So this is a tough and very serious condition, and perhaps in my mind, and this is my mind, is more importantly the long-term consequences of PID, and those are obviously infertility. That's a big thing. So a simple, treatable STI that could have been avoided now has lifelong implications. And we're seeing for example, it's known even with a single PID, event or a single PID infection, it could lead to a considerable amount of infertility. Multiple PID infections could even lead to 50% chances of being infertile. That's massive. That's huge. So minimizing the whole, it's just an infection and it's treatable. I think, sure, we do want to destigmatize. We do want to help. We do want to understand. But we also want the families and our patients to understand that there are long-term consequences here. And some are serious. And we do need to tackle this problem. We do need to educate. We do need to encourage. We do need to allow our patients all the information to be able to make decisions that are best for their outcome and best for their families too. So that's just kind of the PID. And there are a lot of good guidelines on CDC website in terms of PID. But I think the long-term stuff is something that's worrying there. And again, one of the reasons why is maybe we don't have a real grasp at the numbers because they're not typically reportable.
Well, and speaking of reportable numbers, there's a question like where you mentioned prevalence rates and incidence rates. Where can folks go for their kind of local data on that would be specific for the populations they're serving, those adolescents?
Excellent question. Most counties have their own health departments, and they have their own local surveillance systems. Some counties are a bit more further than others. And that's what CDC does. It uses the projections for these multiple databases coming from different states and does projections. But what I can say is if they want to combine, all the big data in terms of how many new infections are reported on a national level, the CDC website, the cdc.gov/STD is the website to go to. And I can put that into the chat box as well, if you'd like. It's a fascinating topic. And again, it bridges on big decisions, Melissa. I think these are big decisions in terms of sexual activity, in terms of relationships. These are the conversations that we should be having with the children. These are conversations that we should be having as colleagues at an institutional level, educational level. This should be a discussion point right on top there, and how relationships are important and how decisions in relationships actually make a difference long-term.
That's such a perfect summary. I love it. This is a great opportunity to pick the brain of Dr. Mitakidis. He has lots of experience. It's been fun to hear of all the ways that all the opportunities and places that his work has taken him. So it's a great chance to kind of get some more information on this important topic.
So something that's important to mention as well, with an STD, there's potential for stigmatization, there's potential for misunderstanding, there's potential for, relationships to be derailed. It is a very sensitive topic. And that's another reason why people don't talk about it. So we don't talk about it, we don't manage it, and if we don't manage it, we're not going to see the changes there. If we don't ask the questions that we need to be asking, and from an encouraging perspective, from an uplifting perspective, from a perspective that says, are you aware of this? Are you aware that this decision is important for you short-term and long-term? Are you aware of the benefits of not making that decision? You know what I mean? Specific to sexual activity. Are you aware of that? So, and I found with a lot of the adolescent groups, just sitting down and talking and conversing and sharing in a caring manner, it's amazing to hear the questions that come out. It's amazing to hear the thirst for information and for knowledge. And that conversation, I think, is something that we need to be having more often. Mother to child, father to child, mom and dad, or partners with each other at different levels at school and whatever. How can I best achieve my future goals? What is going to impact me? What is going to delay my achieving my goals in life? What can I improve on in terms of my relationships?
So important to have those conversations. And I think this topic can be a little intimidating for parents to approach with their kids. So how do you suggest, actually, this goes back to sort of one of the earlier sessions from yesterday. Dr. Foley was talking about asking the youth kind of individualized questions to find out, engage where they're at, to kind of go from there. So it sounds like what you're saying, even with this, is something similar, because you're talking about the importance of awareness with them. What do you do for the youth that may already be sexually active? How do you address this topic with those youth?
Right. So you've just now started another 2-hour session, Melissa. Thank you for that in the last 2 minutes, but that's a very good question. So one of the biggest things, and this is just personal, is, the care and attitude that I have. If I can build a bridge with anyone, I can share my heart, I can share information, in a non-judgmental way. I can give facts and I can care. If that care element is missing, in my opinion, all right, it's sometimes very difficult to just give facts of all the stuff that can happen and all the negative things. But to start a conversation, and from a point of care and a trust, and to not only just to appeal on, here's a virus, but to appeal on the person behind there and say, okay, how are you doing? Mental health is huge amongst, this kind of population. How are you coping? What are your support structures? Maybe not dive in to say, hey, what's happening? Are you aware of what HPV can, cause warts around whatever, right? I don't want to get crude now, but start building relationship, care, trust, and encouragement and uplifting and essentially love, right? I know we call it that, but it's care for the person to a certain extent that turns people. I believe, it's about people at the end of the day. And being a good example and a model of how we treat each other is a huge start. Believe me, that conversation will open up. The trust, once that trust bridge is built, lots can be shared, encouraged as well.
That's wonderful. Thank you. I know I'm throwing a curveball there right at the end. It's actually it's interesting though. I appreciate your response, and I think it echoes the opening session where we talked about human flourishing and the importance of relationships and some of those key domains for human thriving and therefore adolescent thriving. So you unintentionally kind of tied it all back together really well. So I appreciate that. And that you field all these curveball questions. All right, I think we are close to the end of our session here. Let me just make sure I'm not missing any questions from our chat here. There's some appreciation for the information that you shared. And again, I'll remind everyone that you can find all of this on the exchange. shortly after this topical training is concluded. So Dr. Mitakidis, thank you so much for sharing your knowledge and your time and your heart with us. I really appreciate that. So we will look forward to seeing you in our next session. Thanks so much, everybody.
Thank you. Thank you, everyone.